Our differences make us who we are. The wonderful and quirky citizens of Malaysia. At Petra News, we are a platform for the people. We built an environment connecting talents of different backgrounds from every side. Our goal is to inspire people to do the best work of their lives, driven by creativity, innovation, and equality. At Petra News, we celebrate and welcome all dimensions of diversity. We believe that diversity advances humanity. Together, we create solutions that empower people with effective information to make the right choices. We are Malaysia from every side.
Melanda hatiku, tersusun nada irama dan lagu, walau hanya sederhana, tetapi tak mengapa. Moga dapat membangkitkan sederlah kamu wahai insan.
Tak mungkin hilang irama dan lagu, bagaikan kembang sentiasa bermadu. Andai dipisah lagu dan irama,
lemah tiada berjiwa, hampa.
kembang sentiasa bermadu.
Andainya dipisah lagu dan irama,
Lemah tiada berjiwa,
hampa.
andainya dipisah lagu dan irama.
Lemah tiada berjiwa, hampa.
Satu suara, satu semangat, itu sumpah warga berdaulat. Jalur gembira.
Kalau anda pernah terfikir ataupun terdetik, kenapalah aku wujud? Anda kena lakukan sesuatu. Kita mempersoalkan kewujudan kita adalah permulaan sebenarnya yang boleh mendorong kita untuk pergi ke perkara yang lebih berat, iaitu suicide. Sebelum you nak fikir you suicide, you akan mempersoalkan kenapa you hidup tau. Pertama, you rasa you tak guna. You tak guna tu in term you tak rasa pun orang merasakan you berbakti kepada dia. You rasa orang tak appreciate you, satu. Sebab bila kita down ataupun kita sangat sedih, waktu itu saya tak ada semangat nak buat apa-apa. You nak bangun tidur pun you tak ada semangat. You nak makan pun kadang-kadang you tak nak. You just hilang diri you sendiri tau. You macam hidup dekat dalam diri orang lain. So, my whole family tak tahu yang I ada depression. Lepas 3 bulan barulah macam adik I tahu. Tu pun sebab pihak klinik dan hospital nak dapatkan waris. Kalau apa-apa jadi, dia nak contact waris tu. Itu saja, itu je. For the whole time being tu memang kawan-kawan. I ada dalam, tak ramai dalam 7 orang kawan yang memang support. Waktu I down tu, waktu I depressed, I tak boleh fokus pun nak drive. Badan you penat sangat. Even you nak drive pun you penat. So I ada seorang kawan yang memang tak apa Wafa, I akan hantarkan you dulu. I ambil 2 jenis ubat. Satu untuk tidur dan juga untuk menenangkan anxiety. Satu lagi anti-depression ubat lah. Tapi kedua sebenarnya yang orang tak faham, bila kita ambil ubat, badan kita tak semudah itu nak terima ubat tau. Sebab badan kita kadang-kadang tak kuat. Ada side effect yang you kena tahan. Antaranya macam mungkin you punya makan you tak berapa nak okey, you tak lalu makan, you asyik rasa nak muntah, and then you macam tak ada mood. Bukan tak ada mood, you tak memberi reaksi kepada apa-apa pun. Maksudnya kalau you nak nangis, you tak boleh nangis. Ubat tu dia ada efek kepada seseorang. Untuk sesi terapi ni dia banyak fokus kepada macam mana you nak bertenang lah, cara-cara you bernafas dan juga benda-benda yang you kena buat. Talian sokongan dekat Malaysia ni ada banyak. Yang terkenal adalah Befrienders. Tapi selain Befrienders, kita ada Talian Rahmah. Ada banyak lagi lah yang tersedia di Malaysia ni. Tapi yang I guna adalah, ataupun yang I call adalah Befrienders. I ingatlah my first experience waktu I call Befrienders hari Rabu. Yang angkat adalah seorang kaunselor. Kaunselor dah tua. Sebenarnya dalam 10 minit awal I call dia, and then dia cakap hi, hello, and then I just nangis. I tak cakap apa-apa. 10 minit awal tu I just nangis je, and then tapi dia biarkan I nangis. Dia macam no, it's okay, just cry. And then I nangis, and then lepas I dah lega tu barulah macam dia tanya, boleh saya tahu nama awak siapa? Macam tu. Kadang-kadang kalau kita berbual dengan orang kita kenal ni, kita takut kita akan dihakimi. Tapi kalau kita call Befriender, mereka adalah kaunselor terlatih, satu. Kedua, kita boleh cerita apa sahaja masalah dan perasaan kita, dan kita tahu dia akan habis dekat situ. Kalau anda pernah terfikir ataupun terdetik, kenapalah aku wujud? Anda kena lakukan sesuatu. Sebab dia akan kalau dia biarkan lebih lama, secara tidak langsung fikiran anda akan mencari reason-reason yang akan membantu anda ataupun mendorong anda kepada memilih jalan yang berit.
Satu suara, satu semangat, itu sumpah pada berdaulat. Jalur gemilang,
Na-na-na-na-na-na, jalur gemilang, na-na-na-na-na-na.
biru kuning, jalur semangat kami semua.
Jalur gemilang ya tu. Ini orang muda-muda sikit. Jalur gemilang. Oh, okey.
Kibarkan.
They ask you how you are, you just have to say that you're fine. And you're not really fine, but you just can't get into it.
Oh, I need to continue. Oh.
I'm really interrupted by the stoppage of the song. I'm sorry, can we cut? Bawah, di bawah apa?
Jalur gemilang.
Serious.
Maka kami terasa jalur gemilang, kibagalah wawasan merah putih, biru kuning. Jalur semangat kami semua. Jalur gemilang, ta-na-na-na-na-na, jalur gemilang, na-na-na-na-na-na. Okay.
Kejayaan semakin hampiri dia di kota. Oh, saya tak ingat. Beat saya ingat.
Keranamu kami semua merdeka. No.
Keranamu kami hidup berjuang demi bangsa, keamanan negara. Betul?
Keranamu kami hidup selesa, sumpah budi kemakmuran negara.
Sumpah budi
Oh, sorry.
kemakmuran negara.
Alright. Kalau ingat
57
hari bahagia sambut dengan jiwa yang merdeka. Oh, that's the three of it. Oh,
Tanggal 31.
sambut dengan jiwa yang merdeka.
Ramai-ramai menyambut hari merdeka. Merdeka.
Mari kita seluruh warga negara ramai-ramai menyambut hari merdeka. Merdeka. Mari kita
Seluruh rakyat Malaysia.
warga negara
Ramai-ramai menyambut hari merdeka.
Merdeka. 31 bulan 8 57
Mulia.
negara aku merdeka.
I would like to wish all of the Malaysians happy anniversary on our national days. Semoga kita lebih maju dalam segala hal and everything's good upon us. So for the COVID to be ended and life to be written into the same.
Selamat Hari Merdeka.
Okey, saya ingin mengucapkan selamat menyambut Hari Kemerdekaan kepada seluruh rakyat Malaysia. Jangan lupa jaga diri, stay safe.
Selamat Hari Merdeka.
Selamat Hari Merdeka.
Titi Hayun hilang. Titi Hayun tak ada. Titi Hayun tak ada lah. Tinggal Titi Hayun saja. Titi habis.
On a lovely sunny day, the cold streams of Titi Hayun at the foot of Manjurai curve gently through the boulders. It is a very popular place for the locals to relax with their families. However, things took a sharp turn when a heavy flood hit Titi Hayun in a tragic fashion on 18 August. Titi Hayun is one of the most affected locations due to the water column phenomenon. In that location alone, more than 10 homestays were severely affected and some of them even failed to be rescued. Apart from Titi Hayun, the disaster also affected the surrounding areas in 2 districts, namely Yan and Kuala Muda. When the crew of the Vibes arrived in Yan, majority of the residents still forbid and tired from the incidents, which they had never experienced before.
Pakcik kira sebenarnya dia macam fobia. Sebabnya kejadian di sini tu, anak pakcik dan cucu pakcik tu, kita kata tahap macam mengucap dah lah. Semua Allah nak panjangkan umur. Sebab daripada dia setiap call panggil tu, bos call tu call, ayah, ibu tolong, tengok. Minta ampun, minta halal makan minum. Makna perkataan tu makna last punya pesanan lah agak kerja. Mana kata bagi dia harapan hidup tak ada.
The Yusof family residence located in Batu Hampa, about 3 kilometers from Titi Hayun, was among the most severely affected when his house was almost totally destroyed due to strong currents. In fact, his father-in-law, Ku Abdullah 91, was also among the victims of the tragedy. The body of the former imam was found under a pile of wood about a kilometer from their home on the 4th day of a search and rescue operation. During the incident, Yusuf survived because he was in another house in a nearby village and he was only informed of the tragedy from his second child who lived in the unfortunate house with other family members. Yusuf was actually the individual who saved us when we were still busy recording during the heavy rain around Batu Hampa. We only realised the location was becoming increasingly unsafe when he was suddenly approached.
Pakcik, kereta merah. Motor ada satu saya rasa. Okey, dah. Kami try ni. Apa tak dia tak follow? Tak tahu. Pakcik tu takut.
Jadi bila pakcik tengok, pakcik boleh bayang dah. Sebab pakcik tu isi lama. Bila keadaan di rumah pakcik air tinggi, sini mesti dahsyatnya. Bila pakcik tengok keadaan gudi, kemarin pakcik pakcik tak balik lagi. Tengok dah bunyi batu, dugung. Pakcik keluar tengok macam ni, dia ni nak tengok ke? Mana air, jangan ni bahaya ni. Itu yang pakcik kita jalan-jalan. Tak jalan, pakcik tengok air dalam. Boleh pergi takut jalan di tepi pecah. Sebab duk tengok tukar jepam kan. Dia tak jalan kan. Dia nak naik tu. Lepas cik keluar dia naik. Jadi Pak bila turun tu tengok air sudah banyak, jepam tak naik, bertambah fobia. Pasal tengok air tu, pasal Puan bawa menteri nampak tepi batu kan. Sebab takut jadi macam atas. Dia sekejap, tiba-tiba dia datang yang kepala tu. Itu macam fobia jadi.
This is where the massive flood in Gunung Jurai and we have already experienced when the water slowly rising just submerging the road. Will this tragedy repeat and forever haunt the residents nearby? Only time will tell. The tragedy that haunted Yusof led us to find the real cause of the natural disaster that never happened on Mount Jurai. Among our findings was the existence of a quarry of more than 26 hectares near the Tupah Recreation Centre, which is said to be the source of Tupah River becoming so shallow that it is unable to accommodate the flow of water that descends from the summit of Mount Jurai. The situation worsened when the foothills were also explored and leveled for durian tree planting activities and other crops, which were seen to be too close to Sungai Tupah. The same situation was also found in a stone quarry near Singkir, which allegedly affected the flow of a small river that flows through several villages near the area. However, the allegation was denied by Kedah Menteri Besar Muhammad Sanusi Matno, who described the existence of quarries in the two locations had nothing to do with the water column phenomenon, and it was only due to heavy rain that hit the area. President of Sahabat Alam Malaysia, Meenakshi Rahman, when met by the Vibes, said we should not assume that every natural disaster that occurs is simply an act of God.
Walaupun kesan daripada hujan yang lebat macam tu memang ada.
Hi and good afternoon. Welcome to another in our series of VIBEINARs. I'm Manvir, and today we are live right here in the Vibes newsroom to discuss mental health and answer the question, are mental health problems just millennial issues? Right now, we are live on Facebook, YouTube, Twitter. So thank you for joining us wherever you are. I want to let you know that this is not just a panel session, but an interactive discussion. And we want to know your thoughts, comments, and questions. So please do comment on whatever platform that you guys are using. And we have team members checking social media right now, and we will get to your questions soon. But first, let me introduce our esteemed panelists that we have. First off, we've got Dr. Salina Abdul Aziz, consultant psychiatrist and head of psychiatry services for KKM. Dr. Salina is the head of the Hospital Kuala Lumpur Psychiatric and Mental Health Department, as well as the head for Clinical Research Center. Now, she herself has produced more than 30 studies and has been actively involved in shaping the national healthcare policy. Next, we have Dr. Aida Syarinaz Ahmad Adlan, a senior lecturer and psychiatrist at the University of Malaya Medical Center. Now, Dr. Aida has also a private practice at the Specialist Center, where she provides both medical intervention and psychotherapy. I gotta get that right, psychotherapy, which you might know better as talking therapy. Now, her special interests include mood dysregulation and disorder, and we'll find out exactly what that is a little later, as well as eating disorders and trauma. And finally, we have Kenny Lim. Now, Kenny is the executive director of Befrienders Kuala Lumpur, who operate a free and confidential emotional support hotline that runs 24 hours a day, 7 days a week. Now, Befrienders can also be reached via email. Now, Kenny joined the organization as a volunteer over 20 years ago, and today he's part of the team that trains and supervises new volunteers. We're going to be hearing from them, but before we hear from them, let me help set the stage for today's discussion with some stats from the past year, right? Over 140,000 distress calls were received by government agencies from 25th March 2020 to 20th May 2021. Now, 85% of these calls, 85% were related to mental health issues such as acute stress, anxiety, depression, abuse, and suicidal behavior, right? Now, there are also 2,426 reported suicides between 2018 and July 31st this year. And men accounted for over 2,000 of these cases. And finally, during the lockdown periods in early 2020, calls to the Women's Aid Organization and the government's Talian Kasih hotline increased by 44 to 57% respectively, many of them about domestic violence. Scary, isn't it? So let's jump right in. Dr. Salina, I'm going to go to you first. Is this what you are seeing in your practice today? Is there a huge influx of patients to your hospitals and other KKM clinics, Dr. Salina?
Thank you very much. Actually, it's very hard to say that it's an increase in our service because during the pandemic, most of KKM services had to be sort of reduced because we were catering more for the COVID cases. Yes, we had an increase in the outpatient and also the calls in that come in for help. So our services at the Mentari is a community service that we provide where patient can walk in. We have an increase in about 5 to 10% of the usual number of cases. Even in clinic, we have an increase. But I think the increase is more with regards to diseases like anxiety, restlessness, mild depression. These are not the sort of mental disorder that you see in a tertiary center like in HKL. So you see a lot more of the people who are stressed up, who are anxious, who are sad, mildly sad because of what's happening in the environment, rather than an increase in the severity of the severe illness actually.
Okay.
So it is not the increase in the disorder. It's more of an increase in the usual, the normal sort of anxiety and depression that comes with the difficulties in the environment.
Okay, great.
What I can tell is that there is a I think the coping style and the resilience that is affected because of the MCO, because of the pandemic.
Okay, great, thanks. Dr. Aida, you are at the UMMNC and you have both private and public. Has there been an increase on your end as well?
Hi, okay, so I echo with Dr. Salina because during the MCO, we have to observe the SOPs. So we have to limit the amount of patients that come to clinic in UMMC. That's the semi-government part, okay? So there is an increase in people coming for help, same landscape like what is happening in HKL. But from the UMSC side, which is the private side, so one would think that, during the MCO that people don't really go to the hospital unless it's very necessary. So I would expect that the amount of patients in UMNC for my psychiatric clinic is lower, but it's not. People are coming to seek help. And I also see the same pattern, like it's not those major mental disorders, diagnosis of like schizophrenia or bipolar disorders, OCDs, not cases like that, but cases with emotional dysregulation, okay, where they're having trouble with managing their emotions during this very, very pressing times.
So what exactly is emotional dysregulation? I
Okay,
need to find out that. It's a
yeah.
new term.
Right, so, as we feel emotions are very normal, isn't it? Like if my cat died, I would have felt some sadness, okay? But I would, normal presentation would be, I would be sad and I would sit with it for a while, and over maybe 1 or 2 days, I would come to terms with it and my life will go on as usual. That is if I have a good coping skill and a good regulation of emotion, meaning that I can manage my emotions well. Dysregulation means that the balance is lost now. When you have a certain intense emotion, it overwhelms you too much that you can't manage anymore. So these are the kind of patients that I see during the MCO, especially. Okay.
Okay,
I think
great.
that explains the term dysregulation.
Yes. If I get lost in there, I'm going to come back to you again a little later on that. Before I get to Kenny, I just want to remind people that if you have questions, you can go on your social media, Facebook, Twitter, or YouTube that you are, and comment or question from there, and we'll share them with our panelists. Now, Kenny, you are in a unique position because we have got both these doctors. They have got a landed clinic where people need to come there. And obviously over the period of time with the COVID situation, the clinics have been working on limited time. So now, have the calls been increased to befrienders? And what are the more prominent reasons for these calls that you guys have picked up on?
Yes, I think this is where the difference is between the service that Befrienders KL is providing, because we are mainly on telephone and also emails. Yeah, we do have a face-to-face service, but then it was discontinued when the lockdown started last year in March. Yeah, so we do see an increase in the number of calls that we receive, the contacts that we receive. And if we compare to 2019 before the pandemic to the first 8 months of this year, right, we are already seeing an increase of about 25% in the number of contacts that we receive. Yeah, and we also did a comparison between the start of MCO March to May 2020, and then we compare it to the same period, March to May, a year later, 2021. And here we could see there was an increase of more than 50% in the number of contacts that we received. So even 1 year after the pandemic, after the lockdown, right, more and more people are being affected emotionally. Yeah, and to answer your questions on what are most of the reasons people call us about, reasons related to pandemic are such as loss of income related to financial issues, loss of job. And then we also have people who are feeling very much isolated and very lonely because of travel restriction. They're not able to perhaps go back to their hometown and be with their family members. And then there are also people who are struggling with working from home, online studies, stuff like that, yeah.
Okay, it's quite difficult. It's been a difficult time across, for the past 18 months, of course, for a lot of people, but more so for those who've got this mental health disorders. Now, I'm looking at some more stats here. Before the pandemic, now mental health problems have been increasing for a number of years, right? Now, MOH data from 2015, now that's the best that I can go on right now. 2015 revealed that 29% of Malaysian adults suffered from mental disorder. In 1996, that number was just 10%. So there's been a huge increase, right? So I'm going to go to Dr. Salina first with this question. Why is this happening? Why has there been an increase over the past 20, 30 years? And is life getting harder, or is it just the current millennials just can't cope? I know people throw this around a lot, it's the snowflake generation. I don't think so, but is the number increased? Can we attribute it to this in any way, Dr. Salina?
Okay, thank you. Firstly, the number increased because probably the first one is with time, people are more educated. People are educated about mental illness. People come forward for treatment. People have changed in their way of thinking towards mental illness. Okay, it is not seen as it is seen more as a medical entity. So they seek help more. So that's why there is a trend in the increase in the number of cases, number one. Number two, as time increases for the last 10 to 15 years, what happened is we have more hospitals, general hospitals rather than institution that offers mental health services. So you do not need to go to Hospital Bahagia or Hospital Permai. You can only go to the general hospital. And as time increases, now it is also available in a health center. So seeking help for mental illness is not so stigmatizing. People can go to the health center, people can go to the hospital, and this may allow a lot more people to seek help. So I guess the trend in increasing, that is for me, it's a good thing because people are seeking help. Okay, but with regards to what you say about snowflake generation, when you talk about snowflake generation, you're talking about the resilience of the community, the resilience of people, the resilience of the population, resilient of being able to adapt to misfortune and setback. I think that's what happened during the pandemic. When the resilience to the misfortune and setback in life is not there, then you tend to adapt poorly or you cope poorly. I think I'll stop here, let the others have a chance of saying something about this.
Sure. Dr. Aida, do you want to jump in there with something from your point of view?
All right, just to be clear, because some may confuse about mental health issues and mental disorders, okay? So if I'm not mistaken, correct me if I'm wrong, Dr. Salina, the statistics showed that the 30% is people suffering from mental health issues, okay?
Yes,
but
correct.
Those are not mental illness, okay? So there's a difference there between mental health issues and mental illness. Illness means it's a disorder, that means your functioning is disrupted, okay? Mental health issues is like, you know, like your cardiovascular system, like your respiratory system. Sometimes you get cough and cold, so your respiratory system is affected, but it doesn't cause you to have pneumonia or COVID, okay? So everyone has mental health, and sometimes our mental health gets affected once in a while. But when it becomes too bad, too unmanageable, to the point that it's becoming disruptive, you're not functioning, then it becomes a mental health disorder. So let me just clarify that first.
Sure.
And I really like the topic of this snowflake generation. I had to Google it. I'm not sure what snowflake generation is, okay? But what I hear is that I even asked some of my the people in Instagram, so what do they think of this snowflake generation? So the terms that come is entitled, self-absorbed, narcissistic, oversensitive. So those are very harsh accusations towards the millennials. Okay, I agree with Dr. Salina, it's about resilience. Okay, however, I do think that some of these millennials are at risk of developing mental health issues and mental health problems if they can't regulate, can't cope with their emotions well. Okay, you see, when I was younger, my parents used to say, during my time we did it like this, okay, and I felt that I can't relate to them. Okay, now I'm at times at fault, okay, also saying the same thing. During my time, you know, we were more resilient, we were able to cope. Kena marah lah, you go on with it, okay. But the younger generations are unable to cope with that as well as they, you know, I expected them to be. But this could be because they are already in a different era. They can't relate to my era, okay? So some of the things that they highlight, like they become easily depressed or easily anxious, I think it warrants, we need to address those issues rather than saying that, you know, back in my time, we just go wing it or go through it, okay? So I do think that the younger generations might be at risk of developing mental health issues if they can't manage or regulate it well.
Okay, great. Thanks a lot. Well, I know, Kenny, I'm just going to take a stab at this here, but you're probably the youngest person here. So, you know, more of a chance of being one of those millennials or snowflake generation. Your thoughts, please.
Thanks, Manvir, but I don't think I am the youngest here, but let's not get into that, yeah. Okay. Yeah, so I do agree with what Dr. Salina mentioned about the awareness level. Nowadays, it's very much higher if we compare it to, like, let's say 5 years ago or even 10 years ago, yeah. There's more discussion, there's more people talking about mental health, and also we are seeing more and more people who are, you know, courageous enough to come and share their stories, yeah. I would also like to add that maybe challenges at this time, yeah, and also life in this modern world right now may be a little bit more stressful than before. Yeah, maybe, you know, we're talking about expectation from people around you, from your parents, maybe, even from your own self expectation. Yeah, it's very much different if you compare it to 10 years ago. And that's why, you know, as mentioned earlier, resilience, yeah, your coping mechanism, you know, your problem solving skills and all those, are you able to cope with all this? So I think it's not so nice to label them snowflakes, yeah, but rather to look at it from a different perspective, that there are more challenges and maybe they are not equipped enough with all these skills to handle all this stress, all these challenges in their lives. And that also means that, you know, the parenting, how they are being brought up, you know, all this plays a role. Yeah.
Okay, great. Thanks a lot.
Can I add to that?
Sure.
Yes. What you know, the other thing that the other word that was coined was helicopter parenting.
Okay.
Something interesting to me too. Helicopter parenting is when you do not allow your kids to grow, to mature psychologically. It's just like, you know, a mother who physically you feed the child 3 times a day, and sure, it's like, you know, you buffer the child from hurt, from feeling sad, from frustration. The child never learn to cope, never learn to, you know, how to regulate the emotion. So when they grow up, psychologically, they are handicapped.
I see.
When there is life stresses, there is life problem, this coping skill, this, you know, how to deal with trauma, adversity, tragedy, they are not equipped.
Okay.
So I think if you say, I would say what Kenny said just now with regards to parenting skill must be there. We must now allow our children to also, you know, how to say, develop psychologically, not just physically. So this is important actually.
That's a really good point.
Have a psychologically resilient kids.
That's a really good point. We at the Vibes here is probably the youngest newsroom in Malaysia. Our average age is like 32, and I think that half of the people here are going to blame their parents for their inability to deal with some of these issues. It's loads of fun. I've got a couple of questions in, and in the meantime, if you're watching this Facebook, Twitter, YouTube, send in your questions in the comment section. Got a question from Sonia that says, and I'm going to direct this at Dr. Aida first, right? Does therapy still work if it's not face-to-face, Dr. Aida? I mean, we were talking about that therapy. Does it still work, Dr. Aida?
Yeah, okay. So for me, I think the first assessment would require, I'm a doctor, so I would still prefer to see the patient face-to-face, physically examine them, assess their mental status, and do the necessary investigation, okay? But if that person is suitable for just to go for therapy without any other medical interventions, I think online therapy works. But I prefer if it's face-to-face, because in therapy we use a lot of the social the cues. So if it's you know, if like I can see Kenny nodding, okay, so that gives me the comprehension that he's okay, probably he's understanding this. Okay, so to me, therapy works online, but I prefer to have face-to-face, like video call, not just via phone call.
Dr. Salina, how about it from your end? Your thoughts on that?
Okay. Fine. To me, face-to-face is the best, because there are a lot of non-verbal communication that you see. That to me, in psychiatry or psychology, non-verbal communication plays a big role in finding out how a person feels, how a person communicate to their therapy. So if you have a phone call, I think it's not going to be fair to the patient, and also to the therapist, to come to a conclusion, to come to a diagnosis. However, what we do is we do the first few sessions face-to-face. When you already know the patient, when you already know what's happening, you can subsequently do it either online or by phone call. Because when you talk to the person on phone, after seeing them face-to-face, you sort of know when their voice change and whatnot. So it gives you a bit more confidence. For us in HKL, we try to do the first few sessions face to face, then video call or phone call.
Okay, that's a pretty good point. Well, Kenny, I'm going to come to you with this one because, face to face, it may work for these two doctors right now. But I mean, with befrienders, either through emails or through calls, because you're literally the first point of contact. Someone needs help 24/7, 7 days a week. What's your opinion on that? And what do you guys do to try to help people that can't meet a therapist face to face?
Right. It's very much different because we don't do therapy. We are not qualified mental health professionals. We are all trained volunteers who are trained how to provide emotional support and listen to people who are in distress, feeling suicidal, and so on. So it's different because for us, right, it's a helpline where people would contact because they want a safe space to talk about their issues. They can remain anonymous. Whatever they tell us is confidential and it's less threatening, I would say, in a good way. Yeah? Not to say going for therapy is threatening, but then maybe for those who are not 100% ready yet, maybe they would prefer to just talk to someone over the phone, knowing that it's safe for them to share whatever they want to share. Yeah. So I guess for a helpline that works.
Okay, great. Thanks. I got another question in, and I'm going to go to Dr. Salina first with this. Do any of y'all have experience working with mental health issues for people with disabilities? And I know under KKM, you probably got the largest catchment of patients. How about from you, from your point of view? This is a question from Tarmendran, sorry. Yep.
With disability. Yes, we do. I mean, as we have a whole. We cater for all areas, all patients. Doesn't matter whether you have disability or not. So I do not understand what you mean by disability. We see everyone. We do not sort of say people with disability are sort of not seen or not referred to us. So actually, we do not how to say exclude people like this.
Sure, I think
in fact the children with disability is one of the big population that we see in our child psychiatric clinic.
These are physical disabilities. I think that's the meaning of the question.
Yes.
Yeah. Okay.
We have.
Okay. How about on your end, Dr. Aida?
Yes. If we are relating to physical disabilities, same thing like HKL. We are inclusive. Okay. In UMMC, I work in the consultation liaison psychiatry. So where I get referrals from ward all over the hospital. Perhaps when they are having a certain problems like chronic kidney disease and they start developing some depressive symptoms, and we are the referral point to go and see these patients. So we're involved in seeing other patients who are medically ill, and some of these medically ill patients, they are physically disabled. So yes, service across board.
Well, great. I hope Tarmendran, that question is answered. We'll just jump into our second part right now, talking about mental health services across Malaysia, right? The 2020 national budget allocated 344.8 million ringgit to mental health care. Now, this is less than 2% of the country's total budget for healthcare. And this is below the average for an upper middle income country like ours, right? So, Dr. Salina, are we spending enough money on mental health care? And maybe you can tell us about the services that we already have here under KKM.
Thank you very much again. Okay. How to say, money is not exhaustive, you must understand. I think everyone is asking for money, be it renal, be it liver, be it cancer. Everybody is asking for money. I think if I were a finance person at Ministry, I will have a headache. Like this year, it's about COVID. It is a balancing act that you have to do. You macam ada 10 anak, you nak bagi anak mana ni? Everybody saying that they're more important than the other. So I understand their whatever their the handicap that they in giving out money, but with regards to mental health services in Ministry of Health, I think we are doing very well. We have 56 hospitals over the whole country that offers mental health services. 56 general hospital.
Okay.
The whole of Malaysia with offer mental health services. So most of these hospital are hospital pakar minor dan pakar major. That means if you go to a hospital pakar like Selayang, Ampang, you have psychiatric services. Okay, so we have 30 hospitals, general hospital that have beds. Okay, beds for psychiatry. You don't have to go to hospital Bahagia or hospital Permai. If you are mentally unwell and you need to be admitted, you can be admitted in a general hospital, less stigmatizing. So we have 30 hospitals all over the country that have beds. And we have now what we call Mentari. Okay, Mentari, we have about 22 Mentari now. This is a facility that is in the community where you can walk in and talk to them. And get something, you can be assessed by them, whether you need further treatment or not, then you'll be referred to the hospital. And they also offer rehabilitation for that. So generally, I think we sort of cover, and we have 1,000+ clinic that can see or can manage and can diagnose people with mental health issue. And if they have problem, they will be referred to the hospital for further treatment by the psychiatrist.
So just let me get this right.
The service is good. Yes.
Let me just recap. So you've got 56 general hospitals across the country that can do this, and you've got 22 specialized clinics or hospitals on this, and there are thousands of clinics across the country that people can just literally walk in and get a first point of contact help right now.
Yes, clinic setting, yes.
Okay, and how do people find out about this? Is there a website? Where does someone just go and key in something and find out where can I get help? Whether I'm in Batu Pahat or Kedah or wherever, where do they find out this information?
Okay, now that is a handicap. I think a handicap in our handicap in ministry lah. It is on the ministry website, but it says that this hospital provide all these services. But if you were to it doesn't, like you say, where can I get help for my emotional problem? It doesn't come out. Okay. But if you were to Google like Hospital Batu Pahat, it will come out and say that Hospital Batu Pahat, there is a psychiatric department. Okay. So in a way, it's how you search. I'm in Batu Pahat now. I want to see a psychiatrist. I will go to Batu Pahat and search the hospital, and it will tell you what services is available.
But literally, you're saying literally there's about 1,000 clinics across the country. So a patient can walk into any clinic and get a first point of contact.
Yes.
The clinic kesehatan. Okay.
Yes.
Great. Now, I want to just talk a little bit about the staffing itself, right? That you brought up the hospitals itself. Data from 2018 shows that there are only 410 psychiatrists in our country. That's 410, right? Which is a national average of 1.27 psychiatrists per 100,000 people. Now, the World Health Organization has recommended a ratio of 1 psychiatrist per 10,000 people. So we are quite far away from that. We're really far away from that, right? And there are also very few clinical psychologists working in the public sector. Dr. Salina, is this right? I mean, the number of psychiatrists and there are very few clinical psychologists. Is this right?
Okay. Again, you must understand, mental health services is not done as a single person, psychiatrist. No, mental health services is done as a team. Okay, teamwork. It's not just a psychiatrist. It is the psychiatrist, the clinical psychologist, the medical officer, the counselor. Okay, even NGO sometimes comes together. It's a team. It's a teamwork. We as you mentioned just now, psychological symptoms 29 to 30%. I mean, you cannot be doing this alone. Even the government cannot be doing this alone. Right. We need the help of the NGO, need the help of the community to come together to handle this big issue actually. So with regards to that, yes, the number of psychiatrists is increasing. Okay, as of this year, we have 600 plus psychiatrists already. In Ministry of Health, about 300 plus. And clinical psychologists, sadly, in the Ministry of Health, is about 20 plus. But we are part of a team. We work together with the psychiatrist and also the medical officer. So we sort of help each other in the sense that we will screen, and they will be helping us when we think we need assessment like IQ and all that. Other things that the psychiatrist can do, they will take over the work of the clinical psychologist. And we also have counselor that help us with this. So those young do not need therapy as much, okay, more of talking like, about problem with children, problem with husband or wife or, school. Sometimes the counselor can, be the one that do this treatment or assessment rather than coming to us. So you must understand that it is not all psychiatrists. Okay, we work as a team, everybody has their role, everybody can help each other.
Okay, I'm going to go to Dr. Aida with this. Can you please explain the difference between a psychiatrist and a psychologist? Because we're talking about both this and, as part of a team. So what's the job the psychiatrist does and how different is that from the psychologist?
Okay, all right, good question. So the first thing is psychiatrist comes from a medical background. Okay, so we have to become a doctor first. And then after that, we are trained into the specialty of psychiatry. Then we become psychiatrists. Okay. For psychology, psychologists, they have a background of psychology usually, and it's a study of the human mind. Okay. So they probably obtain masters and PhD in psychology, but to see patients, they have to be a clinical psychologist. Not any psychologist can do clinical work, okay? So they have to have this clinical psychology certification. And in terms of the management, so the psychiatrist would see patients based on a medical perspective, okay? Also with the psychosocial interventions, which involve psychotherapy, and some are maybe trained more than not, okay? But psychologists mainly, they are using the theories of the mind to assist them in administering the psychological therapies, okay? So some of the psychotherapies, the psychologists are very good in it. Those things like CBT, cognitive behavioral therapy, interpersonal therapy. There's a lot of therapy going on, okay? And these are based on certain theories, okay?
Right.
So, but sometimes the patients that they see, just by doing the psychotherapy, it doesn't help improve their condition. So that means that perhaps these patients need more help in terms of medical health. So this psychologist would be referring them to us for biological management, means to administer treatment. Okay. So psychologists mainly do the talking therapy.
Right, psychologists do the talking therapy. And so between, like Dr. Salina was just now talking about, we've got 600 psychiatrists right now under the KKM and 20 psychologists, you were saying. So do we need more psychologists in Malaysia generally? Do you see that need, Dr. Aida?
Yes, I do think so. But I think more importantly, we need more clinical psychologists in the government sector.
Ministry.
Yeah, because there are, I think, correct me if I'm wrong, but I think there's a lot of clinical psychologists practicing privately. And yeah, they can, I mean, patients can have access to them. They have their own clinics, they are practicing. But I think the KKM especially needs more. I think if we can get more, definitely it will be a great addition to this.
That would be great. Just to correct you, actually the 600 is private, public hospital, and also university. Ministry of Health is about 300 plus only.
Oh, 300. Okay, great. Good, nice of you to point that out. Before I get to you, Kenny, it's estimated that only 20% of Malaysians with mental disorder have access to professional care. And the social stigma is probably a major reason why. This is a Cambridge University paper that was produced early this year, right? So Kenny, do you agree that, and why are not enough Malaysians getting the help that they need? That you see calls increasing, especially over the past 18 months. What do you think about that?
Yeah, I think stigma definitely plays an important role, or is an important barrier to people seeking help. Yeah, because of a lack of understanding of the issue of mental health and also suicide. That there is this stigma attached to it, and then there will be labeling, for example, and then with that it creates a lot of fear, a negative perception of the public towards people who are struggling. So it may actually hinder the help-seeking behavior in someone who is struggling because of the fear of being labeled, being looked at differently, being ridiculed, and things like that. I think that is one major barrier. But other factors may be because of limited resources also, due to financial issues maybe, or not knowing where they can go to, not having enough support from within their own family members, for example, because making the decision to go and see a professional, it's actually not that easy. Yeah. So if you do not have the support from people around you, that may be actually very difficult to basically make that step. Yeah. So these are some of the issues that prevent people from seeking help, I believe.
Okay. Great. While we're doing this, we've got people sending in questions. You can do that on Facebook, our Twitter, and also YouTube if you have. I got a question here from Mansia, and I'm going to direct that at Dr. Salina first. What impact is social media having on our mental health, especially for millennials? Dr. Salina.
Okay. One of my suggestions when I give lecture on the pandemic is to switch off social media for a while. Social media has a lot of, now you are isolated. Okay, you're isolated when you are during the MCO. You're isolated. You're isolated from your friends. You're at work. Even though you go to work, you cannot eat with your friend. You have to eat by yourself. You go out and shopping, you cannot go with your friend. You are emotionally isolated, really isolated. So a lot of us turn to social media to fill in this isolation, to fill in this gap in our our life. Unfortunately, social media needs to be regulated, and it is self-regulated. Itu masalah dia. Bila self-regulated, sampai you don't know how to self-regulate.
Yeah.
So I think one of the things that has been suggested, if you have to really limit your social media. Probably if you want to live a happier life, you must be more restrictive in the sense who you friend with, which website you go to and whatnot, So it makes your life happier because you don't need all the other stuff, okay? So yes, it has a big impact, especially now that we are socially isolated, where we turn to social media for this entertainment, for friendship, for connection. I think, but we ourselves must learn how to control this so that social media does not affect your life too much.
Sure. I get what your point is, and I agree with you. Unfortunately, we live in the social media age. Dr. Aida, what do you think? I mean, the question for Man was over there. Social media, how much of a bearing does it have on mental health issues, you think?
Yeah, I am a firm believer of regulation and moderation. Okay, so I do think that some of these technology, they are there to initially become somewhat of a facility to us, to help us, to aid us. But when we become dependent on this too much, okay, we are starting to become an addict to social media. So any kind of addiction, that means you're giving in too much to this source. So yeah, my take is that if you use it, then use it wisely. But once you start becoming affected by, like, you started to become very envious of people who has portrayed very, very perfect life, very perfect outlook and whatnot, and then you start becoming very much affected, comparing your life to that. Why is my life not as perfect as that? And this is true story. I've got patients coming in, and the complaint is, why are my friends having a better life? Okay, that's true. So when you are seeing this impact on your life, I think you need to step back, have what Dr. Salina was saying, like a break, like what we call it now, social media detox. Yeah.
Wow.
So that you can introspect and see, look, these impacts are just not healthy anymore. I've got to take a break.
Oh, that's a good point. I mean, just maybe all of us just forget about following the Kardashians for a while. Kenny, your point of view, social media, mental health, is there a huge connection there?
Yeah, I think when we talk about social media, it's a very interesting topic lah. Yeah, nowadays, most of us cannot live without social media. Yeah, but there are pros and cons of course. Take for example, someone who is struggling with mental health issues. They may go to social media to get support from even people that they do not know. Yeah, and I've seen cases like this where people do actually get support from going sharing about their struggles on social media. But then the other side of it is that you cannot also control what others are going to say to you or how they are going to respond to your post, right? So you may be able to get support, but at the same time, you may also be able to get some not so nice comment. Yeah, so I think besides moderation, self-awareness also plays a very important role here. You need to know how much you want to share, and you need to realize that whatever you share it out, right, you can't basically take it back. Yeah, you have to be prepared with how people are going to respond to it. So ask yourself, how much do you want to share, and what are the consequences? Be aware of what you are doing. Yeah.
Okay, good point. I'm just going to allude to this one. On September 17th, our Prime Minister said that emotional pressure and financial difficulties are the highest motivations for the recent spate of suicide cases in the country. He said that on the 17th September. Now, yesterday in Parliament, it was finally announced that attempting suicide will be decriminalized. What effect will this have? And do you agree, disagree with this? Dr. Salina, I'm going to go to you first on this.
Wow, okay. Okay, it is a good thing that is happening. I think we must be very careful with regards to when we talk about legalization, or are you talking about decriminalization? I think what they are talking about is decriminalization of attempted suicide, which means somebody who does this act, okay, might not be regarded as a criminal act. Legalization is you allow somebody to do this. It's different, okay? So I think most of the people are not agreeable to legalization, but we are agreeable to decriminalization. Okay. Yes, it is a good step because it allows those who need help, it allows those who are giving this cry for help an avenue to get help, okay, rather than being punished for their behavior or whatever they have done. Okay, so it is a good step, but there are certain things that need to be looked into. I think before 306, the Criminal Code 306 be abolished. I think 309, where they say that whoever attempts to commit suicide and does any act towards the commission of offence shall be punished with imprisonment for a term which may extend to 1 year, or fine, or both. So this one, I think they're looking into that lah.
Okay.
Which is the good thing happening. Yes.
That's good. Kenny, you're probably the first person that, I mean, your organization that people call. So what are your thoughts on this decriminalization of that?
Yes, we have always advocate for this to decriminalize suicide, yeah. Because what we believe is that, people who are feeling suicidal, what they really need is treatment, is care, yeah, not to be being punished. And we have heard stories from our callers saying things like, "Oh, now that I know that it's a criminal, it's a crime act, right? I will make sure that the next time if I do it, I will make sure that I die." Things like that. So we don't see it as a preventive measure. Yeah. So I'm really glad that we are moving forward with this.
Okay, Dr. Aida, your thoughts on that?
Yeah, it's indeed quite good news. Welcome that, and I'm glad that Dr. Salina clearly differentiate the decriminalization and legalization. Yeah, so I think this is a wonderful news.
Okay, I'm going to go to Dr. Salina next because while we were preparing for this and we were talking to you all about incidences where parents or even children who needed help were not getting help because of this social stigma. And I think there was this story about this little student, maybe Dr. Salina, you want to share that story?
Okay.
Sure.
Okay, barriers to seeking treatment can also be one of the other things is a fear of negative outcome. Fear of negative outcome, for example, if I go and my company knows about it, I'll be out of a job. Or if I go, the university finds out about it, I might be rejected from university, or I might never get work. That is fear of the negative outcome. But sometimes it can be also not perceived or not seen as a problem. Okay. I have children who children are the millennial people, okay, who has been educated, who has been brought up to accept mental illness as a medical illness. Okay, so when they are depressed, when they are sad, they will come and they will seek help. They will seek help, sometimes through social media, sometimes through their parents, through their teachers. I had a child who was a teenager who seek help through the teachers, but the teachers cannot bring this child in because you have to bring the parents together. But when the child tells the parents that I'm depressed, I'm feeling like the mother say, no, you shouldn't speak like that. You you must back up and whatnot. So this mentality of the older generation, okay, that perceive it as not a psychiatric problem, stop this child from getting help. Okay. So what happens is this child decide, okay, you don't want to listen to me. He attempted suicide.
Wow.
So when he attempted suicide, it's a good thing because of this criminal thing. He ended up in the hospital. Okay. Ended up in the hospital for treatment of the suicide. So attempted suicide, sorry, and he was referred to us. So he finally got the help. But what saddens me is the fact that the parents at that time cannot take this as a cry for help from their child, to come to psychiatry, to come to a health center, to get a doctor to see this child, to help this child. But the child has to take another sort of route to come, to get help. Right. So it is very sad to me. So when people do not perceive this as a problem or as a serious problem, this happened in our older generation actually.
Wow, that's very sad story. Dr. Aida, have you had any incidences that you can mention just briefly so that people are aware of different ways of cry for help?
I think the story that was mentioned is sadly it's quite common. Yeah, because when people don't see a psychiatric illness as a medical condition, but what they see is that it's a weakness, it's not enough iman or tak cukup semayang, It's like okay, imagine if someone met with an accident and patah kaki. You would immediately bring that person to the hospital to get the necessary treatment. Okay, imagine if that person patah kaki and you just say, your bones are not strong enough, So it's ridiculous. So yeah, if only people can start seeing, because there's a lot of studies showing that some of these conditions, it is memang evidently due to the neurochemical imbalances, and if you can see the amount of patients improving with medications, okay, and they would treat it as a medical condition, and when something happens, you're sick, you get help. Okay. Sometimes I do see similar kind of presentation where parents are not aware of the and very unaccepting. So I always tell some of these patients that you gotta know where to seek help, like you gotta know where to mobilize support. If you feel that your parents are not there yet in understanding your mental health issues, then maybe you don't seek help from them. I'm talking about young adults or maybe adults, okay? But you can start mobilizing help from your friends or from peers that is more understanding of your condition. And then when you get to seek like a psychiatrist, for example, you can liaise with the psychiatrist to have a joint session with your mom. Okay, see it from a medical perspective, because that's what we do in psychiatry meetings. We get the family members to come in, and if the parents won't want to hear it from the child, but they may have some, you know, like maybe they accept that, okay, this doctor is saying something true.
Okay, good point, good point. Dr. Salina, I got a question for you. This one's coming from Rebecca, who has commented. In the meantime, people, you can comment by sending in the questions to us on Facebook or Twitter or YouTube. There's a question for Rebecca. What are the factors for the lack of psychiatrists in our country? Is psychiatry not a popular option among doctors, or is it because of the low demand due to the lack of public awareness on seeking professional help for a psychological problem? Your thoughts on that, Dr. Salina?
No, we have enough doctors asking for doing the psychiatric specialty course. We have a lot. In fact, every year we have about 60 to 70 psychiatrists graduating now. Quite a number actually, quite a big number now. I think because the training after you become a doctor, for you to become a psychiatrist, you need another 4 years. So if you become a doctor, you need to be study for 6 years, and then you become a medical officer, and then you study again another 4 years. It takes a long time actually to become a psychiatrist or any specialty. So it is a long-term investment. So it takes a while from doctors to become psychiatrists. I think our production of psychiatrists has been exponential for the last few years, and we will catch up, inshallah. That is not going to be a problem. We have enough psychiatrists.
So if it takes about 11 years before someone starts specialization to become a psychiatrist, how long does it take for a psychologist, a person wanting to do psychology and clinical psychology?
Psychology needs a degree in psychology. Then they need to do master in clinical psychology. If I'm not wrong, degree is 4 years, master is 3 years, about 7 years. Still a long time.
So that's a different process as well. Okay, great. Any thoughts on either one of you, Kenny or Dr. Aida? None to add into that about psychiatry? No. Okay, great. No problem. We move on. You can keep those questions coming in. Now, moving on to the next part of it. Kenny, your volunteers that you have are all trained in listening well, right? So if a loved one comes to us and is struggling, what can we do to help? I mean, you guys got a lot of calls. And so what can we do to help? And do we need to provide solutions to this person who comes to us? What are your thoughts?
A very good question there. So I think the first thing is that we need to be empathetic to the person, the person who reached out to us, or even someone who hasn't reached out to us, but we realize this person to be struggling. It's important for us to have that empathy, the ability to put ourselves in the other person's shoes, and reach out to that person and show that we care for that person. So I think here, listening is very, very important. I think the misconception of helping or supporting another person is to give a solution or to advise that person what to do, which is not the case. From my experience at the helpline at the Befrienders KL, most of the time when people contacted us, right, they just needed someone to talk to, they just needed an ear to hear me out. So I think that is very important. To allow that person to open up about whatever that's troubling them, to be able to validate their feelings. For example, if they're feeling angry, we don't say things like, oh, don't feel angry, chill, calm down, things like that. But to allow that person to express his or her feelings and validate those feelings. I think that's very important, spending enough time with them. Sometimes if you don't know what to do, you may also ask that person, what can I do for you? What do you think is best for you at this point of time? How can I support you? I think don't worry if you feel like you do not have the skills. What is important is that as long as you are concerned for that person, reach out to that person and tell that person. And if you feel like you can't do anything, try to find alternatives with that person. Hey, let's see where we can go to for help. Things like that. Yeah.
Okay, great. That's great help there. Being empathetic, just listening and understanding that. I'm going to go to Dr. Aida with this one now. We've got lots of cases, you know, some and on suicide. And if someone actually comes up to us for help, and there have been many stories in suicide cases where family and friends say they had absolutely no idea, and this is unexpected, that someone that they knew committed suicide. Now, how do we know if someone we love, we know, needs help or needs professional help? Are they those telltale signals, signs, Dr. Aida?
Yeah, okay. So usually when someone has some thoughts of wanting to end their life, it doesn't, I mean, sometimes people can have it impulsively, but you know, usually there'll be a gradual change. And if our loved ones manifest some kind of behavioral changes, that would be some good telltale. So first, maybe they would start being socially isolated, like they don't, you know, they don't enjoy meeting people too much. They rather prefer to be in their own room. Okay, so and before that, they're the type who used to, you know, go out and meet friends. So there's some changes there. They're becoming more socially isolated. So that's one thing that you can keep a lookout. You might also see people who, you know, usually quite jovial and quite stable, suddenly easily ticked off or very irritable for the slightest thing. So that could be some changes there too as well. If that person starts to be having crying spells, you know, they get overwhelmed easily with certain situations, could be a telltale. If their sleep is important, okay? So if your sleep pattern is starting to become more and more disrupted, could also means that there's something not right going on with you. Okay, so these things are probably the rest can also add up, but these are some of the telltales that could mean that someone is in trouble. Or when they start saying, like, you know, sometimes they say, Kenny, tak apalah. You know, they want to say something and then they retract. So that's also something that they want, but they just feel they don't know how to express their emotion. So this is when you can start asking them, like, you know, hey, you look like you've changed a bit for a while. I'm quite worried about you. Are you okay? So these are some of the telltales I would think of.
Okay.
The rest
Salina,
yeah.
Dr. Salina, anything to add? Because I mean, you've got the largest catchment of patients possibly across the country.
Okay. There are other signs when they are close to committing suicide, you know, when they start doing things like putting things in order, you know, like things with family, things with, you know, who gets what, and then the last things, they will put things in order. Then you start you know, wondering why is he doing all this sort of thing. Okay, what Dr. Aida said just now is mainly the symptom of depression. Okay, but when the depression has gone to the point where they find that there is no more going back, hopeless is there already. The hopelessness is there. Is, you know, I have got to end all this. And when they say I've got to end all of this, then they start planning for their demise. So they do a lot of things, you know. They start doing will, they start giving you instruction, and you find out, hey, why is this guy talking like this? Then you should probably talk to this person seriously, sit down, or even bring for treatment. Because yes, I have seen, but most of the time they give small telltale signs. And when we talk, we do psychological autopsy. What we call psychological autopsy is after a suicide, we go and talk to the family. So when we do psychological autopsy, this is when we pick up the small things that they tell the family that, I mean, most of us are not psychological or mentally being trained to pick up all this. We are most of us are, you know, normal people. We don't know how to pick this up. Probably you need to learn a bit more, especially those who live with people with depression, to know how to learn to pick this up. And then, you know, so that you, if this come up with your loved one, now you can, you know, sort of bring this person for treatment.
Okay,
so
great.
I think that is important.
If I
Sorry,
could add,
Aida.
No, nothing. Sorry. Yes, what you said is I totally agree. That there's the stigma, or not stigma actually. There's this fear of family members or loved one. Like sometimes when they say that I feel like ending my life, okay, don't say like that. Okay, so that is no, don't do that.
Right.
Actually, from my experience, if someone expresses suicidal ideation, it's not a bad idea to talk about it. Like you familiarize yourself to talk about it. Like, okay, so you're feeling suicidal now. Let us understand why are you feeling suicidal. So it's contrary to popular belief that when you talk about suicide, you will induce suicidal ideas. No. When someone comes to you with some suicidal ideas, talking about it can actually provide some kind of relief.
Okay, I think Kenny, your organization, the Befrienders, probably has the people of calling you as last resort. Your thoughts, and what do you guys do?
Yes, I do agree with what Dr. Aida mentioned about talking about suicide openly. The myth is always, if you talk about suicide, you may plant the idea, you may give the idea to that person. But that is not true, because research has shown you can never plant an idea in a person's head, especially suicidal ideation. So what we do at the Befrienders, we ask the suicide question to all our callers. Yeah, and I can say that most of them actually are okay to talk about suicide. They are quite open to basically answer, if you're feeling suicidal or not. And from there, we actually, like what Dr. Aida mentioned, right? We go into the topic of suicide, like what is making you feel this way? How does it feel when the suicidal thoughts come to your mind? And basically, we let them talk about suicide. Because in real life, you will probably not have a chance to talk about it to your family members or to your friends, because like what Dr. Aida said, right, they will say things like, don't talk about suicide, things like that. So by calling the Befrienders, we want them to be able to talk about something that has been troubling them a lot. It's something that, because research has also shown that people who are suicidal, there is always an urge or a need for them to talk about their suicidal ideation. Yeah. So here, when they call us, we want them to be able to talk about it, about anything, about your pain that you're going through, right? It's okay to share. And from my experience also, after talking about it, normally, so the calls may last for an hour and a half. After that, we would do the assessment again. We would ask again, so are you still thinking about ending your life now? So most of the time they would say things like, oh, no, I'm just feeling very tired now. I would need to get some rest. Yeah. So by talking about suicide, it actually brings relief. Yeah. It actually doesn't make the suicidal thoughts go away forever, yeah, because it will come back to them, yeah, later on. But at that point of time, I think it really helps to let them talk about it and find relief for that point of time, yeah.
Okay, this is awesome stuff that we're listening to and learning right here. So upfront, we need to talk about it. I mentioned the word suicide upfront so that people are aware of it, because obviously listening to both the doctors here, there are telltale signs from people. They drop hints along the way, and if we don't pick it up, then it's people like Kenny gets that last call. And even when he and your group of people who listen to these people, and you're able to make them think about other avenues rather than taking that final outcome. That's great. That's a great point. Got another question in from Facebook. You can send it in Facebook, Twitter, or YouTube. Comment there. Got a question from Shazmin, and I'm going to go to Dr. Aida with this. Mental health in an unequal world is the theme for the World Mental Health Day this year. Now, why is professional therapy so expensive and inaccessible to the majority of people, Dr. Aida? But before that, I just want to mention this, that in Malaysia, unfortunately, I think there's only one insurance company that recognizes mental health as an issue, and you can get some money from your insurance company to go and get some treatment. But so why is mental or professional therapy so expensive, Dr. Aida? It's the money thing.
Okay. Well, first of all, as we discussed earlier during our session just now, mental health services are available in the government sector, and if I'm not mistaken, it's almost free.
Everywhere.
I think RM5 Dr. Salina sekarang. Yeah, it's just it's just RM5. So I'm not too sure why you view that this is very expensive. However, in the private practice, yes, but as for any other private sector in any medical field, the prices are a bit more premium. Okay,
right.
So there are, I guess this is this is my answer. If you feel that you cannot get the premium service from the private sector, okay, we have available services in the KKM, in the government sector, and also in the semi-government, like in all the university hospitals. Yes,
Okay.
it is comparable to any other medical condition.
Sure. Okay. Thank you. We've got the last 20 minutes in here, so I just want to get into this one: prevention. So, what is good mental health, and how do we protect ourselves, our families, and our workers' mental health? Dr. Salina, I'm going to go to you first with this. How do we prevent it? Are there tips, something like that?
Okay. Like our physical health,
Right.
we have to take care of ourselves to ensure that physically we are fit. You know, if we do not take care of ourselves, we become fat, we have hypertension, we have diabetes. You know, what we have done is, if you want to stay physically, we have things that we should do every day. Okay, so how you build muscle, you must walk 10,000 steps, you know, a lot of things. You must exercise 20 minutes a day. You have to keep your cardio up. So we build our physical, just like how we build our physical resistance, we should build our mental health, our psychological build up. Okay, right. One of the things that you can do is wellness. Okay, just wellness. Like you, wellness, that means wellness. So exercising, jogging, you know, you can do wellness like mindfulness. Okay, there's a lot of program on mindfulness. And then you must take care of your body at the same time. Okay, you can do a lot of positive mind manipulation. Sometimes they have relaxation therapy, yoga. These are all wellness that helps your mind calm down. Okay, after working like 12 hours or 8 hours, your mind really needs something to sort of shut down. Not really shut down, means to come down and to relax. You know, it's not just something that you can do by itself. Sometimes you need to do it. So we are not doing it now. We're not. Well, most of us do not do it. We wait until we are. If you are a worker, you wait until you are burnt out. You use up all your energy. You use up everything, your motivation, until you are burnt out. Then only your employer will send you for some motivation, some whatnot. It shouldn't be like that. It should be like exercise. It should be done every other day or every week, so that you can recuperate your psychological mind. Then you be you will be resilient and then your psychologically it built up, just like your muscle building up. So there need to be some sort of wellness. Okay, then you need to have connection. Your connection, yes, connection. You prioritize who you have a relationship with. Connection. Why people cannot talk? Can talk to Kenny, but cannot talk to your father or your mother or your sister. Why? The connection is lost. That's why they need to call up Kenny. If the connection is there, they could have talked to their father or their mother or their sister. The connection is not there. We need to prioritize and not break our connection. We must ensure that in our normal daily life. If you start feeling lonely, then you must find your connection back. Connection, join groups, okay? Then you need to also have a purpose, meaning in life. A lot of people now, especially the young ones, are very lost actually. Very lost. You know, I think Kenny will get a lot of that on your phone call. Very lost, you know, and when they have traumatic experience, they don't know what they should do and what not. I think that one, I think that also explains why some religion works in stopping suicide. Okay, when you have this purpose, when you have this meaning in life. Okay, it does not mean religion. It can also mean spirituality. Okay. Okay, I think I will stop that.
Sure, Kenny, anything to add? I mean, for ourselves, our co-workers or family, how?
I would think that the connectedness is very important, as mentioned by Dr. Salina, right? Invest in relationship with your family members or friends so that, you can have someone that you can open up to when you are not feeling that good, right? And apart from that, I think it's also important for all of us to learn about the symptoms or the warning signs of someone who's struggling with mental health issues or feeling suicidal, because then this early intervention can be done, because when you realize someone to be struggling, to have shown some of those symptoms, right, then you can actually reach out to them and start supporting them. I think when we talk about suicide prevention, that is something that is very, very important to learn about what are the warning signs and also to take them seriously. That is all that I would like to add. Yeah.
Dr. Aida, anything to add on that?
Yeah, extension of the wellness concept that Dr. Salina has mentioned. I think one of the thing is self-care. Okay, so some people misunderstood self-care by being selfish. That's not the case at all. Okay, so when you prioritize yourself, it gives you a I always work better by examples, right? Okay,
sure, go ahead.
Let's say if you're the commonest that I give is when you are on the plane and the stewardess will always say that when the oxygen level is low, if a mother has an infant, okay, so when the oxygen thing comes down, you put on yourself first. Yes. And then after you're stable, you put it on your child. So the meaning is that you have to make sure that you are well first before you can assist others. So that's why I think self-care is very important. And what can we do apart from the exercise and whatnot? Do things you enjoy. Don't feel guilty, because humans work by reward. When we do something pleasurable, we feel good about ourselves. The problem is sometimes, I see this also in the younger people, that they feel guilty for wasting time to do things that they like. That's not true. Okay? So prioritize yourself, because self-care is not selfish.
Yeah, self-care is not selfish. That's a good point. I've got a question, Dr. Salina. I'm going to direct this to you. This is for Mani, and she says, I've been wanting to seek help, but I'm still jobless and money is an issue for me. So may I know if seeing a trainee counselor, psychologist, psychiatrist, as they are much cheaper, can help me, or is it better to see an experienced professional? And she says, because the government sectors are almost always full and unavailable. What do you think about that? How would you answer Mani?
Wow, I think she should seek help, firstly. Okay. I do not, I guess right now with the COVID pandemic, there might be some issues getting help at the health center, but most hospital, the outpatient clinic for psychiatry is available. Okay. And you can seek help there actually, and it only costs you $5. So I don't think it's going to be that expensive. Of course, if they will do a triaging when you come, they do triaging, see whether it's the case needs to be seen urgently or it can wait. If it can wait, then they give you an appointment. We have never sort of reject any case.
So
what happened? Sorry, carry on.
No, doctor. So I'm just asking. So does that mean you just walk into one of those KKM clinics and outpatient clinic and ask for help?
For general hospital, they need a referral letter.
Okay.
For health clinic, you can walk in.
So for health clinic, you can just walk in. A general hospital, you need a referral letter from the KKM clinic.
Yes, or from the GP.
Or from a GP.
General practitioner, yes.
Well, Mani, I hope that answers your question. I got another question from Mansha. I'm going to start with Kenny first for this question. As COVID-19 moves from a pandemic to an endemic, will mental health challenges have a more prolonged impact, you think, Kenny?
I would think so, yeah, because it's not something that you can solve within such short period of time. Because when we're talking about lockdown, pandemic, many of the people out there are being affected in their finances, because from the calls that we have been getting, right, we are seeing an increase in the number of calls of people talking about losing of job, struggling with financial issues. There are also cases where people call us to ask where can they go and get food, as basic as that. So I think it is something that we would still need to deal with for quite a long time to come.
Dr. Aida, what's your opinion on that? Is this going to have a longer effect on people?
Yeah, I do think so because if we look at the long COVID, the sequelae of the COVID pandemic and also the illness itself. Okay, so I've seen patients after recovering from COVID, they still have that anxiety, the depression, anxiety mostly because of their traumatic experience that they have undergone. Okay, and that doesn't just resolve suddenly when they are well. I also understand that sometimes when you are recovering from COVID, your lungs are not as good as before. So you probably can't do as much as you could have before. So all these things have impacted their life, day-to-day life. So all these can cause some mental health issues as well. So I feel that, it doesn't end when the pandemic becomes endemic. The sequelae of it still manifest and we got to deal with it appropriately.
Okay, Dr. Salina, you probably see the most COVID patients or long COVID, COVID survivors coming back to you guys. How have you seen handling it? What are the major issues from those patients who have gotten COVID?
Well, for those who has got COVID, we have done a study actually. We have sent out a survey where I think about 3,000 people answered us, okay?
Wow.
Yes, we find that a lot of people are suffering from anxiety, as a result of the COVID. There are some, also quite a huge number that have cognitive disturbance, have cognitive disorders. They find that, but we have yet to call them back to find out what exactly is wrong with them. But yes, COVID, whoever has had COVID will have some psychological effect. Okay, we have seen a big number with regards to anxiety, with regards to depression, not just by the COVID, also by the stigma of COVID, by the what COVID has caused to them in the fact that they might not get jobs, they might have this fear to mix. I had COVID actually about a month ago, so even people, my relatives still ask me, is it quite safe for me to talk to you? That that is like, oh, okay. I tell them, yeah, I had COVID, but the germs are all gone now. I'm not going to infect you. You see that the effect is still there psychologically. People are interacting with you, also have some reservation, and the fact that you can get physically handicapped also by COVID in some people because it affects the lungs. So you might not be able to walk as fast, you might not be able to take steps, you might not be able to take stairs, so that can handicap you also. Some young people are being handicapped by that. So it's going to affect you psychologically too. So
okay, great.
Yes, it will affect, but it can be treated. We can help you.
So that's for COVID patients itself, people who have suffered from that. But as it moves from pandemic to endemic, what is the KKM doing to help people more? I mean, over a longer period of time, as was the question from Maksha.
Once it becomes endemic, it is just like flu. Flu is endemic. Everybody have it.
Right.
But we are so used to being locked down, travel restriction. The fear of that is still there. Because we were instilled with fear that, I can get infected, I cannot talk, I cannot touch. So actually, once it becomes endemic, it's endemic. It's everywhere. So to live with it again is to live with COVID around us is it takes some some changing in your mind. That it's okay to touch, it's okay. I'm already vaccinated. You go around saying that I have been vaccinated 2 times, like it's okay to come near me. So that sort of mentality. And now you want to hug your children, you want to hug your friends. You that fear is there. What if because the last time you hug somebody, you gave them COVID.
Right.
So that fear in some people might still be there. So some behavior in the community might not change so fast, okay? But I think we will heal from this. We will heal from this slowly. Just like we took 2 years for us to control. Yes, it will take some time for us to adapt. I think human beings are very resilient. I think we will adapt. We will be able to go through this, inshallah. And I think we can come out okay.
Good. Well, we've got one last question. We got about 6 minutes left on the clock. I'm going to go to Dr. Aida with this one. Comes from Amalina, this question. Adjusting to the emotions and stresses of caring for someone struggling with mental health can itself be challenging. So how can I be a better listener? Is there a support group for those who have to deal with living with a person suffering from mental illness? Dr. Aida?
Okay, so let me get this straight. Is there a support group for those who have to deal living with a person suffering from mental illness? Yes. If I'm not mistaken, Malaysian Mental Health Association, MMHA, is the association has been here for a long time, and these are catered for those who have mental illness and those who have to care for mental illness. So I think you could check out MMHA. Okay. So to be a good support to someone with mental illness can be very, very tiring. Okay. So acknowledge that it's okay to know that sometimes you just reach your limits. Okay. It doesn't mean that you're a weak person or a bad person for having those feeling that I'm tired of this. It's okay. So acknowledge it. Now take a breather. Okay. If you need to find help, seek help in terms of caring. So I'll give you an example of someone who has to care for a patient with dementia. Okay, so dementia is a neurocognitive disorder. Okay, so caring for someone with dementia can be very, very challenging. Okay, so sometimes you do certain things and the patient with dementia will accuse you of not providing them food, accuse you of stealing your things. So it can get very enraging. Okay, but I think when you are facing this stress, take a breather, stop, ask for help. Maybe you can take turns with your siblings to take care of your demented father. Okay, rotate, find ways to deal, because challenges are there, but we can manage it if we know how. If we put things into perspective and we manage them. Okay.
Wow. Okay, good answer there. Thank you so much. Got one more final question. We're going to run into overtime, but don't worry. Maybe a couple more minutes over. I got this question, very good question from Winnie. Considering that mental health issues are increasing amongst the youth and young adults, this is a very important question. What are the mental health programs in schools or workplaces that can be helpful in creating the awareness, prevention, or support of those suffering from these mental health issues? Kenny, I'm going to go to you first with that one, and then Dr. Salina after that. What do you think, Kenny?
I'm not sure about the program by the government, by KPM, but what we have been doing is that we have been answering requests from mainly universities and sometimes schools to run programs for them, awareness programs on self-care or on suicide prevention, as in the skills, listening skills. How do you support people from who are struggling? Yeah, so that is what we have been doing, and it has been quite positive, I would say, because we are seeing an increase in number of requests from year to year, not only from universities, but also from, corporates now. Yeah, so that's a good sign, actually.
Dr. Salina, workplace, schools?
Okay, actually, there is a program called Minda Sehat that is put in schools and also with the adolescents, okay? But actually, I feel you shouldn't make a program for like just mental health, because this is already stigmatizing, school children, when, my daughter tells me when she goes for a program or something talk or mental health, people ask, are you not well? Are you something wrong with you? Why you go for that talk? That the stigma is still there. I think you should make a program that is wholesome. You add to the physical, you add the psychological, so the program should incorporate all. So I think now school is doing that. A program that not only talks about physical health, but it also talks about mental health. It also talks about spiritual health. So it should encompass all. It shouldn't be isolated in silo. So, and then when you put it in silo, it becomes stigmatized. So I think the ministry, be it Ministry of Education or Ministry of Health, I think we are working so that we have a program that is more wholesome rather than mental health sahaja.
Okay, great. I'm just going to ask you for your final thoughts as we wrap up. It's Mental Health Awareness Day in a couple of days' time on the 10th of October. I'm going to go to Dr. Aida first, maybe in the next 60 seconds or something. Just wrap up your final thoughts on what people should do for mental health awareness. Dr. Aida.
The 60 seconds, okay. So fine.
Or a little bit more. I don't have a watch on me.
All right. So like I think earlier I said that mental health is part of your bodily health. Okay, so you got to take care of your mental health, prioritize yourself, self-care, and sometimes when you do have overwhelming circumstances and you feel intense emotion, it's okay, right? Firstly, acknowledge that emotions are normal. Okay, when it get too intense, okay, let's sit through with that emotion, because sitting through with your emotions will start making you feel becoming more resilient. Because when you sit through with your emotions, okay, you have stretched your capacity to deal with difficult things. So what I guess I wanted to say is that it's okay sometimes. If you're not okay, acknowledge that, and then we'll do something about it. Seek help, because help is available.
Wow, that's really good. Thanks a lot. It's okay to not to be okay all the time. Kenny, your final wrap-up thoughts for Mental Health Awareness Day in a couple of days.
All right, I would like to tell people who are struggling out there, right, to reach out to someone, to talk to someone that you can trust, your friends, family members. If you don't have someone that you can reach out to, you can always call a helpline. Befrienders KL is 24 hours. And apart from Befrienders KL, there are also many other helplines out there, yeah? So please know that there are people who care for you. You do not have to suffer on your own. Yeah.
Okay, thank you. And finally, Dr. Salina?
Well, mental health is for everybody. Everyone can help somebody. So I feel that if you are a member of the society, take time to talk to someone, take time to be kind to someone, because we are living in a society that is too isolated. Okay, if you are in the commuter, in the bus or at the bus stop, you see someone who's down, just say hi, just say something, talk to them. You don't have to talk about, you just have to talk about the weather or something. Sometimes your kind action, your kind words can be the difference between, jumping from the building or, moving on with your work, moving on with your life. So talk to someone who, if you see them down, okay, be kind to somebody. Everyone has to do this, not just the psychiatrist or psychologist. And everyone can help a person with mental health issues. Thank you.
Those are three really good points. I mean, it's okay not to be okay, Dr. Aida. Connection, keep the connection open with people, Kenny. And, everyone can help someone. That is so nice. Thank you so much, Dr. Salina, Dr. Aida, Kenny. Thank you for being a part of this. And for everyone who's just watched us on Facebook, on Twitter, and on YouTube, if you've missed this or part of it, and you want to watch it again, you can do it. We have a recording of this on YouTube and Facebook. You can like us and follow us, and we will be doing more of this. Thank you so much once again, panelists. So great to have you guys on and to listen and learn so much. And I hope that people have taken away a lot of good vibrations from you guys and good tips. Thank you so much and have a great day. Thank you.
Thank you. Bye.
Bye. Bye.